The big myth: masturbation is harmless no matter how you do it. What if you already have symptoms? If you are experiencing weaker erections, lower sensitivity, less desire, slower reactions, and difficulty finishing? Hi. Today we are talking about something almost every man does, but almost no man understands: masturbation. Not the joke, not the taboo, not the secret habit you learned as a teenager. I'm talking about the real science behind it, the part that no one teaches you, the part that most doctors never explain, and the part that 91% of the men get wrong without even realizing it. This isn't about shame. This is about protecting your sexual health, your energy, your sensitivity, and your long term performance. And trust me, once you hear what I'm about to explain, a lot of things in your life will suddenly make sense. So let's get into it. The big myth: masturbation is harmless no matter how you do it. Wrong. Masturbation itself is not harmful. In fact, it's normal and healthy. But how you do it, and how often you do it, and what you use to get aroused, those things can absolutely affect your body in real ways. Sometimes subtle, sometimes serious. If you're new here, my name is Dr. Ani Railkar, and I help men and women over 30 with low testosterone increase their testosterone levels naturally so they can enjoy a good quality of life. So let's get back to the topic and let's start with the biggest danger almost every man overlooks: the damage no one talks about: overuse. Many men go years using far more pressure than their penis is designed to handle. And here's the problem: when you overstimulate yourself, your nerves become less sensitive, your body needs stronger stimulation, you squeeze harder, faster, tighter, and this starts creating micro injuries. Inside your penis, there are tiny sponge like chambers that are supposed to expand with blood. Excessive pressure can irritate the blood vessels, create micro tears, lead to scar tissue, and over time, reduce blood flow. Scar tissue doesn't show up overnight. It builds quietly year after year. And eventually, men start noticing weaker erections, reduced sensitivity, difficulty getting aroused, needing more effort to feel anything. And most men don't connect the dots. But this is step one of the decline. Number two, the brain problem. Porn rewires your signals. Now let's talk about the part that affects millions of men today: porn powered masturbation. I'm not here to judge anybody, but you need to understand what happens biologically. Porn isn't like real intimacy, it's intense, constant novelty, and extreme stimulation. Each time you watch it, dopamine spikes, your brain gets a huge artificial reward, and your arousal system gets overstimulated. And your brain starts learning, I need this level of stimulation to get turned on. Real touch, real connection, real intimacy starts feeling too quiet. Not because something is wrong with you, because your brain adjusted to unrealistic intensity. This is why so many men tell me, Doctor, I want intimacy, but when I'm with my partner, nothing clicks. Your body isn't failing, your brain is overloaded. Number three, what aggressive frequency does to your hormones. Every ejaculation requires recovery time, not weeks, but hours. Your body needs time to rebuild sperm, restore semen volume, rebalance testosterone, and allow nerves to reset. But when you do it often, testosterone dips temporarily, you feel more drained, and your energy crashes, and your libido gets inconsistent. And here's something most men don't know: too much ejaculation over a long period can reduce sperm count, sperm motility, semen volume, and overall vitality. Again, not permanent, but definitely noticeable. Studies show that healthiest range for most men is about 15 to 20 ejaculations per month, and that includes sex and masturbation. Not 5 times a day, not once every 2 weeks, a balanced rhythm. So how do you do it right? How do you do it the right way? A healthy, safe, science-based guide. Here's what I recommend to my patients. Frequency, 2 to 4 times a week. This gives your nerves, hormones, blood vessels time to recover. More than that, you're stressing the system. Technique, avoid the death grip. If you grip too tightly, your brain and body get used to pressure your partner simply cannot replicate. Instead, use lighter pressure, slow down, focus on sensation, not speed, and imagine real intimacy. You're retraining your nervous system. Reduce or eliminate porn. You don't need to quit overnight. Just slowly reduce it. Use imagination, memories, fantasies, and this reprograms your brain to respond to real touch again. Check your after feelings. Ask yourself, do I feel relaxed or tired or energized or ashamed? Your emotions afterward tell you a lot about your habits. What if you already have symptoms? If you are experiencing weaker erections, lower sensitivity, less desire, slower reactions, and difficulty finishing, don't panic. These issues are highly reversible. Here's what works: better sleep, more hydration, healthy fats and zinc, omega 3s, pelvic floor exercises, less porn, and more cardio and blood flow movement. If you're worried about vascular damage, see a doctor. There are therapies that can help restore the tissue. You are not stuck. And the real message here is that masturbation is not the enemy. Your body is not the enemy. Your biology is simply responding to the world we live in, a world full of overstimulation, stress, and unrealistic expectations. The goal isn't to stop. The goal is to do it in a way that protects your sensitivity, supports your hormones, keeps your erection strong, and keeps your intimacy real, connected, and satisfying. Slow down, feel more, let your body reset. You'll be amazed at how much confidence improves when you stop fighting your biology and start working with it. If this gave you clarity or helped you rethink your habits, drop a comment below. Let's talk like grown men, honestly, without shame and without judgment. And if you're serious about improving your sexual health at any age, hit the like button and subscribe. This is Dr. Ani, and I'll see you on the next video. Thank you.